Alright, good afternoon everybody. My speech is on the use of steroids. Alright, for users we have bodybuilders, long distance runners, cyclists, and various other athletes. Here we have Marion Jones, Alex Rodriguez, and Jose Canseco. They've all been found guilty for using steroids. So for types of steroids we have anabolic steroids. They're similar to the male type sex hormones in the body. They stimulate muscle tissue to grow and bulk up in response to training by mimicking the effect of naturally produced testosterone on the body. They can remain in the body anywhere from a couple of days to about a year. They may improve endurance, strength, and muscle mass. And here we have a picture of steroids. Steroidal supplements, they contain DHEA. They're found at health food stores or gyms. They're now illegal and require a prescription. They're weaker forms of androgen. Companies that manufacture them often use false claims, and very little is known about the long-term effects some of these substances have on the body. And here we have a picture of Andro 100. Okay, they're administered orally, injected, gels or creams. There's 100 variations. Cycling, which involves taking multiple doses of steroids over a specific period of time, stopping for a period and starting again. Users also frequently combine several different types of steroids in a process known as stacking. Forms of steroids, we have water-soluble, capable of being dissolved, especially easily dissolved in some solvent, usually water. Okay, and here we have a list of commonly abused steroids. On the left we have oral steroids, on the right we have injectable steroids. Okay, so the first one is decadurovin. It has been used to effectively treat HIV and AIDS and is known as a phenomenal steroid for building muscle mass. For this we have depo-testosterone. They're responsible for normal growth and development of the male sex organs and for maintenance of secondary sex characteristics. Okay, and the last one is a popular brand name for the veterinary injectable steroid, boldenone. It's a derivative of testosterone, which inhibits strong anabolic and moderately androgenic properties. Okay, so for street names, we have Arnold's, Gym Candy, Pumpers, Roids, Stackers, Weight Trainers, Gear, and Juice. So for short-term effects, for adult men, we have reduced sperm count, breast development, loss of function of testes, shrinking of the testes, difficulty when urinating, premature balding or hair loss, sterility and painful erections. And here we have a, I don't believe it's a real picture, but so it'd be kind of funny, so. Okay, for adult women, we have facial hair growth, deepened voice, breast reduction, menstrual cycle changes, and enlarged clitoris. And here we have pictures of women on steroids. So for both sexes, we have acne, bloated appearance, rapid weight gain, high blood pressure, and jaundice. And here is a 21-year-old male who used steroids, injectable steroids. The top is in the beginning. It turned into acne, and these are scars left over, permanent. Okay, and for adolescents, it halts their growth prematurely. Okay, and here we have a poster that tries to stop steroids. It says, steroids, not in my game plan, how about you? So for behavioral side effects, we have increased aggression, increased irritability, and depression. Okay, and we have a picture here of roid rage. On the left, it talks about building bigger, stronger muscles. And on the right, we have the bad, which is aggression, depression. We have heart attacks, blood clots, weakened tendons, liver damage, and tumors. So for long-term effects, we have cardiovascular disease, heart attack, stroke, blood clots, and liver damage. Okay, and here we have a picture. It's a blood clot and then a plaque in the arteries. So for steroid trafficking, it's smuggled from Mexico and Europe into the United States. It's Schedule 3 of the Controlled Substances Act. Okay, and here we have a picture of steroids. It's a drug bust in Spain. Okay, and so for user population, 1.7% of 8th graders, 2% of 10th graders, and 2.6% of 12th graders reported using steroids at least once in their lifetime. And on the left, we have lifetime use for 10th graders. From 1998, it was 2%. In 1999, it was 2.7%. And then perceived risk of harm for seniors, On the left for 1998 is 68%, and in 1999 it was 62%. So penalties for steroid abuse: the possession or sale of anabolic steroids without a valid prescription is illegal. Simple possession is maximum penalty of 1 year in prison and a minimum $1,000 fine for a first offense. Maximum penalty for trafficking is 5 years and a $250,000 fine if it's a first felony drug offense, and if it's a second drug offense, maximum period of imprisonment and the maximum fine both double. Conclusion: abuse can lead to fines, jail time, or even death. Steroid abuse is not worth it. Thank you.